Next, we're going to move to cranial nerve 3, 4, and 6. So the ocular motor, trochlear, and abducens respectively. So this is going to be testing extraocular movement. So I'm going to have you with your head still follow my pen light in the cardinal directions. Okay, that's cranial nerve 6, lateral rectus. Cranial nerve 4, superior oblique. And all other directions will be cranial nerve 3, ocular motor. Excellent. Next, we'll move to the trigeminal. So I'll have you, which is cranial nerve 5. So I'll have you go ahead and clench your teeth. And I'm feeling the strength of the masseter and the temporal muscles. And then I could also test the corneal reflex at this point, which would be taking the cotton swab and placing at the just the lateral portion of her eye and noticing the reflex there. Also, we could elicit soft and sharp touch on both sides of the face, noticing for her ability to detect whether it's soft or sharp. So have you go ahead and close your eyes. Tell me if this is soft or sharp.
Soft. Sharp.
Okay, and then we do this bilaterally. Next, we're going to move to cranial nerve 7, which is the facial cranial nerve. So have you go ahead and shut your eyes tight, and then smile, and frown, and puff your cheeks out. Excellent. Then we'll move to cranial nerve 8, which is the acoustic cranial nerve, and we'll do the Weber test for lateralization and the Rene test for air conduction, which should be greater than bone conduction. So I want you to tell me whether you hear equally on both sides. This is the Weber test.
Sorry.
So she hears it more on one side, so that's a deficit, and it shows lateralization to the affected ear. And then we'll do the Rene test. So I'm going to strike this pin on your mass rate process, and I want you to tell me when you cannot hear it any longer.
Okay.
Can you hear it?
Yes.
No.
I can't hear it anymore.
Okay, but you were able to for a little bit.
Yes.
Okay. So air conduction should be greater than bone conduction, and the length was similar. Next, we're going to move to cranial nerves 9 and 10, glossopharyngeal and the vagus cranial nerve. So we're going to assess for the rise and fall of the uvula. So have you go ahead and say ah. Excellent. And also I'm be assessing the gag reflex at this point and noticing any nasal tone to your voice. We can move to cranial nerve 11, which is spinal accessory. I'll have you go ahead and shrug your shoulders. Okay, excellent. And I'm noticing, as that's happening, the strength of the sternocleidomastoid muscle. And also you can move your head towards me and push it the other way. Excellent. Lastly, we'll do the cranial nerve 12, which is the hypoglossal. So I'll have you go ahead and stick your tongue out, and I'm noticing any deviation, which there isn't. So we can move forward to the other special test for the neurologic exam. So I'll have you go ahead and stand up, if you would please. We're going to do the Romberg test.